For 40 years, Intermountain Hospital has been the lead resource helping those struggling with substance abuse and mental illness. I sat down and spoke with Dr. Christina Harrington and Dr. Theron Adamson to learn more about addiction. What is addiction?
I think it depends on whether you're asking clinically or practically. Practically, it's that phenomenon of craving. Once I start, I can't stop, can't live with it or live without it. What do you think clinical would be?
From a clinical standpoint, we start to see changes in behavior, an increase in use. We start to see the development of tolerance. Patients use higher and higher doses of the same substance to get the same effect. And then often by the time we see them, they have tolerance, and we deal with the withdrawal and detox.
Are there specific red flags that people should really keep an eye out for?
Well, I think in addition to that change in behavior and the idea that I can't live with it and can't live without it, it would be, as Dr. Harrington was talking about, the change in behaviors and
you see people have more relationship problems, they start to miss work, they have legal issues, they get a DUI, things of that nature.
And are people with addiction, are they typically aware of their issue?
I think absolutely people are aware of it. It's when did it start in the progression of the usage that's harder to identify.
So if somebody watching is aware that they have an addiction, or perhaps they've identified somebody that they think has an addiction, how do they get help? What do they do?
I think intermountainhospital.com is a good resource. Plugging into deciding whether or not you have to do inpatient or outpatient care.
Okay, and when it comes to Intermountain Hospital and the services you provide for addiction, what are those services?
We initially assess the patient whether or not they need detox services, and we detox specifically from substances like alcohol, benzodiazepines, opiates, and other substances. And then detox usually lasts 4 to 5 days, sometimes a little longer depending on what the patient needs, how long they've been using, how severe their disease is. And then we would transition them into more of a rehab program where they're attending groups and meeting with their therapists and doctors.
And where do our viewers go for more information?
Intermountainhospital.com is a great resource. It'll get you in touch with a professional to talk about your needs.
Great, thank you.